Hello, I'm Captain Scott Connor of the United States Public Health Service, and I am honored to be serving as the Acting Regional Director for Region 7 of the United States Department of Health and Human Services. Region 7 serves the states of Missouri, Iowa, Kansas, and Nebraska. From our offices in Kansas City, Missouri, we oversee the department's activities and act as the front door to HHS. On a day-to-day basis, my team speaks with governors, mayors, tribal leaders, and partners like you about HHS policies, programs, and regulations to ensure that our efforts take into account your experiences and the needs of your communities. Since taking office in January 2021, the Biden-Harris administration and HHS Secretary Javier Becerra have focused on specific ways to improve the lives of the American people, and we have made real progress. On COVID, we have more tools than ever to prevent, fight, and treat COVID-19, including vaccines, boosters, and therapeutics that work. We have a public education campaign underway to remind folks that vaccines are safe and effective. We are working around the clock to ensure that no matter who you are or where you live, you can get health care when you need it. This year, a record 14.5 million people enrolled in quality health care coverage through the health insurance marketplace. Nearly 6 million of those are newly enrolled in coverage. Here in Region 7, 529,000 people enrolled in affordable health coverage, with all 4 states reporting record or near record enrollment. To meet a long overdue need, we've made behavioral health care a priority and invested billions in programs, grants, and other initiatives. In October, we rolled out a new strategy for overdose prevention, one that focuses on prevention, treatment, harm reduction, and recovery support. And this year, we launched the national tour to strengthen mental health to bring attention to the new services available. Here in Region 7, the regional staff is working with groups in every state to launch the new 988 Mental Health Crises Line. 988 is more than just an easy number to remember. It's a direct connection to compassionate, accessible care and support for anyone experiencing mental health-related distress. We realize that the pandemic has led to increased drug use in many communities, so the regional staff is working with community groups on new strategies to reduce the toll taken by drug overdoses and to make treatment and recovery more accessible. We are also making enormous strides in health equity to ensure that every resident of Region 7 has access to quality health care, whether you live in St. Louis or Sedalia in Missouri, Lincoln or Hastings in Nebraska, Davenport or Sioux City in Iowa, or Wichita or Garden City in Kansas. We've recently launched initiatives to improve maternal and prenatal care because we must bring down the unacceptably high rates of illness and mortality among Black, Latino, and Native American women and their newborns. Lastly, I would be remiss if I did not recognize the crucial work of public health and clinical health professionals throughout Region 7, whose work over the last 2 years has saved countless lives. HHS is working hard to assist them in their work and to provide funding to find ways to reduce burnout among clinical care staff. Looking ahead, we will continue building on these accomplishments. We want to make sure progress is curbing prescription drug costs, putting child care within the reach of all, and strengthening home health care. In the Midwest, we like to tout our quality of life, our vibrant cities and scenic rural areas. At HHS, we work often behind the scenes to make that quality of life even better. I'm excited about the possibilities that lie ahead. I invite you to join with me, and we can work together to serve the people of Region 7. Thank you for spending this time with me.
Produced by the U.S. Department of Health and Human Services.